Good afternoon, everyone. This is Mark Markison, Sales Manager for the Johns Hopkins Medicare Advantage MD plans. I want to thank you all for taking the time out of your busy day to spend some time with us and go over the plan for 2019. So during this meeting, we're going to learn about Medicare and the Johns Hopkins Advantage MD, the PPO plan, which is the Preferred Provider Organization, and the HMO, which is the Health Maintenance Organization. So today we're going to talk about your eligibility. We're going to do a little thing called Medicare 101 and our Advantage plans. So who qualifies for Medicare? Well, if you're a U.S. citizen, you're age 65 or older, if you're under age 65 and been disabled for 24 months or longer, or you're living with end-stage renal disease, you qualify for Medicare. So who can join the Johns Hopkins Advantage MD plans? Well, you have to have both your Medicare A and B. You can't have end-stage renal disease, which is kidney dialysis, and you have to have a permanent residence in our service area. So the service areas for Johns Hopkins Advantage MD is for folks that live in Anne Arundel, Baltimore, Baltimore City, Calvert, Carroll, Howard, Frederick, Montgomery, Somerset, Washington, Wacomico, and Worcester counties. You have to have a permanent residence in those counties in order to join the Johns Hopkins Advantage MD plans. So we're going to take a couple minutes and go over Medicare basics. I call this the Medicare 101. So you have several different election periods for Medicare. You have your initial election period, which is known as the IEP. That's 3 months before, the month of, and 3 months after your 65th birthday. Then every year from October 15th to December 7th, you have your annual election period called AEP. Then from January 1st to March 31st this year, you have the Medicare Advantage open enrollment period where you can go from one Medicare Advantage plan to another, or you can go back to original Medicare. And then throughout the year, we have what's called a special enrollment period, SEPs. And that's for things where you're just moving into the area, you've lost your coverage, things along those lines. So let's talk a little bit about parts of Medicare. So your Part A is your hospital insurance. Now, these figures are for the 2018. So we're going to go over the 2018 deductibles for Part A and Part B. So Part A is your hospitalization. There's a $1,340 deductible per benefit period. After 60 days in the hospital, you would be responsible for $335 a day for days 61 to 90. After day 90, from days 91 to 150, you would be responsible for $670. And then after day 150, you pay all hospital costs. That's your Part A. And that's free for most people because you paid for that when you've paid your payroll taxes when you were working. Your Part B is your medical insurance, meaning your doctors and diagnostic and things along those lines. Part B is optional, and there's a standard $134 per month premium for your Part B. Part B is an 80-20 plan, meaning that 80% of the medical insurance is paid by Medicare, leaving you the other 20% to pay. And there's an annual $183 deductible for your Medicare Part B. And once again, these are numbers for 2018. They could change for 19. Part C is your Medicare Advantage plans, and they're offered by private companies. And Part C can cover some of the costs not covered by original Medicare. It can have extras such as your fitness and wellness programs. It can include vision, dental, and hearing options above original Medicare. Some offer prescription drug coverage. The Johns Hopkins Advantage MD is a Medicare Part C plan with prescription drug coverage. And Advantage MD is not a Medicare supplement plan. So your Medicare Part D, your prescription drug coverage. You can get Part D coverage as part of a Medicare Advantage plan, such as Hopkins, or a standalone drug plan. They're typically run by private insurance companies. You pay a monthly premium. You pay a portion of the drug cost, and the coverage can vary from plan to plan. Part D has 4 phases, and I'm going to go over those 4 phases with you right now. You have your deductible, your initial coverage phase, your coverage gap, and then your catastrophic. This is your basic Part D plan under Medicare. So, under your Part D, this is how the 4 phases work. You have an initial deductible of $415. So the first $415 is on you. Then you go into what's called the initial coverage phase, where with you and the plan, you both pay $3,820. Once the $3,820 is paid by both you and the plan, and very simply, let's do some simple math. Let's say you're on a Tier 1 drug with Hopkins, and it's a $4 copayment, but the drug retails for $100. That $100 you paid in the 4, the plan pays $96, but the $100 goes towards that $3,820. After you and the plan pay out $3,820, you go into the coverage gap, what's also known as the donut hole. At that point in time, you're going to pay 25% of brand name and 37% of generic. Once you pay out $5,100, you go into the catastrophic phase, where you're going to either pay 5% or $3.40 for generic and $8.50 for brand name, whatever is higher. That is your standard Part D under Medicare. So under Part D, you can get some extra help. That's known as LIS, which would be a low income subsidy, and it's available from the government if you meet certain income requirements. And those who qualify, they can get help paying their monthly premiums, their co-pays, and their co-insurance, and their deductibles. And you have to contact the Social Security Administration to see if you qualify for that. And there's the Social Security website, www.ssa.gov. So, whenever you're choosing a plan with Medicare, you have to consider your own individual needs, such as cost, benefits, where your doctors are, where your hospitals are, your health history, and the convenience of both your hospital and your doctors. It's a very personal decision that you have to make. So let's talk a little bit about the Advantage MD plans that we are offering. So Johns Hopkins for 2019, we have 3 plans. We have our Johns Hopkins Advantage MD HMO, we have our Johns Hopkins Advantage PPO, and then we have our Johns Hopkins Advantage MD Plus PPO. And Johns Hopkins Advantage MD, they're Medicare plans with PPO and HMO contracts, and enrollment in the Johns Hopkins Advantage MD depends on an annual contract renewal. So this is how an HMO works, a health maintenance organization. Everything is in-network. You pick a primary care doctor, a PCP, and then that doctor will refer you to specialists or anything above and beyond a specialist hospital, things along those lines. It's very restrictive. If you go away from the network, then everything you have to pay is 100%. So you want to make sure when you join an HMO plan that you take the time to see if the doctors are in the network, so that way you have very low cost co-pays and out-of-pocket expenses. A PPO plan stands for Preferred Provider Organization, and obviously in this particular case, the preferred provider organization is Johns Hopkins Doctors and its network. If you stay in network, you can self-refer to a primary care doc or to a specialist. You do not need referrals as you do with an HMO. And there is an out-of-network benefit where the cost could be higher, such as the co-payments and the co-insurance. But you do have the freedom to go out-of-network if you want. Once again, there are no referrals required for the PPO plans. So, the Johns Hopkins MD HMO. I'm just going to run down some of the highlights of the plan. You want to refer to the summary of benefits and evidence of coverage for more information. So I'm just going to highlight some of the particular benefits for the Johns Hopkins HMO plan. Your premium is $25 a month. If you live in Baltimore City, it's a 0 premium. Your out-of-pocket maximum, which would include your co-payments, would be $6,700. Your primary care doctor visit is $5. Specialist is $50. Your inpatient hospital stays. From days 1 through 6, you're responsible for the first $310. After day 6, everything's covered at 100%. Your outpatient hospital coverage is $300 copay. Emergency room is $90. You have your ambulance copay of $300. Preventative care is zero, and I'm going to go over some of the preventative care benefits in a later slide, but that would be a zero copay in network. Included in the $25 premium or the zero premium is your prescription drug coverage. You get preferred generics as low as a zero copay. You get post-discharge meals after you're in the hospital, and it does give you some vision, dental, and hearing benefits above original Medicare. That is the Hopkins MD HMO plan. The Advantage MD PPO plan, and these are all in-network copays. The premium this year is $60. Your out-of-pocket maximum, once again, that would include your copays, would be $6,700 in-network. Your primary care doctor visit is $10. Once again, your specialty visit is $50. Once again, your inpatient hospital days 1 through 6 are $310. Outpatient hospital coverage is $300. Emergency room, once again, is $90. Ambulance is $300. We do have in-network preventative care at zero copay. Prescription drug coverage is included in the premium with preferred generics as low as $7 for a 30-day supply. And this also gives you dental, vision, and hearing benefits. And the plan benefits can be higher for out-of-network share costs. And once again, you would want to refer to your evidence of coverage and your summary of benefits. The PPO Plus plan is a $90 a month payment premium with your out-of-pocket maximum, once again, at $6,700 for in-network. Your primary care doctor visit drops to $5. Your specialty visit, once again, is $50. Inpatient hospital stays, once again, are $310 for the first 6 days. Outpatient hospital coverage is $300. Emergency room is $90. Ambulance is $300. You have that zero premium for preventative care in network. We do offer the Silver and Fit program included at no cost, and I'll have a slide for that in a few moments. Prescription drug coverage is included in the plan, in the premium, with generics as low as $4. It does give you the vision, dental, and hearing benefits. It also, with the PPO Plus plan, you have a worldwide emergency care for a $90 copay, and then you have worldwide urgent care for a $40 copay. And once again, the plan also pays for benefits for services received outside of the network, but in some cases, the share cost could be a little bit higher. You want to refer to your evidence of coverage and your summary of benefits. This chart here just shows the same, basically the last 3 slides. You can take a moment and look down, and you can look across and see the premiums, both for the Baltimore City residents and everybody else, you're out of pocket. So just take a moment, look at that. It gives you a real good matrix as to what the different costs are and the different copays associated with the HMO, the PPO, and the PPO Plus. So I spoke earlier about the preventative services that are available at zero copay for in-network. Some of the preventative care benefits are annual routine physical exams, immunizations, screening for mammograms, cervical and vaginal cancer screenings, prostate screening, colorectal screening, nutrition education, a 24/7 nurse chat line, smoking cessation. We do have a Hopkins specialty appointment line dedicated to you folks. Eye disease screening, and diabetes screening. These are all available to you at zero copay in network. So let's talk a little bit about the Advantage MD difference. So we have a dedicated care team, and we're connected with you wherever your health care journey. Our dedicated team is made up of primary care physicians, specialists, and other health care professionals. Our goal is to provide preventative, transitional, and complex chronic care. Our approach is holistic. Your dedicated care team can help you with consultations, appointment, treatment, and medication, health education, and condition management strategies. And this is available to everyone that signs up for the Hopkins MD plans. I spoke a little bit about the hearing aid benefit that we have in all 3 plans. The hearing aid is included at no extra cost. Johns Hopkins covers 2 hearing aids per year when you purchase through our product partner, True Hearing. You pay either $699 or $999 per hearing aid for up to 2 True Hearing Advanced or Premium hearing aids every year, or 1 ear per year. Then you have 3 follow-up visits with True Hearing for fittings. You have a 45-day trial, and then you also get a 3-year manufacturer warranty for repairs and one-time loss, and 48 batteries are also included. And this is available to everybody in all 3 plans. The dental benefit. We offer a supplemental dental benefit above and beyond the cleanings and x-rays that we have in the 3 plans. You can get extractions, root canals, crowns, dentures, oral surgery, fillings, and things like that. There is a 6-month waiting period for these things, and the dental benefit is available for purchase when you do sign up for either plan. I spoke a little bit about the Silver and Fit program that's included in the PPO Plus, and that is available to you for the HMO and the PPO. And it's a fitness plan with designated facilities, the YMCA, and you can work that there in the comfort of your own home. You can choose a program to get 2 fitness kits every year, and they also have healthy education materials. It's included, as I mentioned, with the Advantage MD Plus, and it's also available for purchase with the Advantage PPO and the Advantage HMO. And as I mentioned, you can get the Silver and Fit, and you can get the dental. With the HMO and the PPO, it's $32 a month. They're both, you buy them together. You can't get either one separately. So you either get the dental and the Silver and Fit with the HMO and the PPO for $32. With the HMO, with the PPO Plus, because Silver and Fit is already included in the premium, the supplemental dental would be $28. Remember, there is a 6-month waiting period when you purchase the supplemental dental. These are just a sample of the ID cards that would come to you if you join our plan. You can just take a moment and look at them. So, that's my story, and I'm sticking to it. If there are any questions, I'll be happy to answer some questions. Questions? Okay. The question is, in the HMO, do we need doctor referral for annual vision, dental, OBGYN, EKG, routine checkup? Yes, in an HMO, you need a referral for everything. How do I get a summary of benefits? You can you can go onto hopkinsmedicare.com, www.hopkinsmedicare.com, and it has a summary of benefits on our website, or you can call and get a packet that would give you the summary of benefits. Or you can see my contact information up there. You can call me direct at 410-241-0788, and I will gladly get together with you and give you a packet, or you can email me with my email address, rmarkison@jhhc.com. Next question, if you go to a hospital that is covered in the network, but the ER doc is not, what is the cost? Well, if you go through the emergency room, it's a $300 emergency room. However, if you're traveling throughout the country and you have an emergency situation, then all the hospital costs would be covered in network as long as it's an emergency situation. Once you go past the emergency situation, you would be released and you would go back to your original Johns Hopkins doctor. My in-laws are interested in the plan. They usually go to the beach house in Fenwick for a few months a year. Are they covered in Delaware? Once again, if it's an emergency situation, they would be covered. If they have a permanent residence in Delaware, they can't join our plan, but there are some doctors in the network that cross over into the Delaware area. I would advise your parents or your in-laws to take a look at the provider directory that's available on the www.hopkinsmedicare.com. You can put in a zip code, and it will show the providers that are in that network. If you go to a hospital like the Mayo Clinic for special treatment, what would the cost be? That's a good question. If it's an emergency situation, if it's a PPO plan, you can go to the Mayo Clinic. You would have to pay out-of-network cost, But if it's an HMO, if your doctor referred you to that, I'm assuming that it would be covered. But I tell you what, if the person that made that question asked me that question, let me check on that to get the right answer for that. So please give me a call and I'll check on that for you. Any other questions? Okay, well, I want to, oh, is there one more? I think I might be seeing one more come in. Do I have to go to Baltimore for my treatment? Well, no, you don't have to go to Baltimore for your treatment. This is where with the HMO, you pick a doctor close to where you live. You would go into a provider directory and you would pick a doctor, in Glen Burnie or Anne Arundel County or Calvert County, wherever you want to go, and then that doctor would refer you to the doctors or specialists within that area. Certainly, if you want to go to Hopkins, you certainly can. For the PPO, you have the choice to go wherever you want to go. Once again, if you go out of network, there are some cost sharing and some co-insurance that might be higher. Is routine dental, you get one cleaning. In the routine dental, you get one cleaning per year. Yes. You get one cleaning and one x-rays. You get one cleaning and x-ray with the PPO plan, and with the HMO and with the PPO Plus, you get two. Anything else? Okay, well, I want to thank you. And once again, the person that did send me that question about the Mayo Clinic, let me check on that. Please call me at 410-241-0788, and I'll get the proper answer for you. That's a question I've never been asked before, so that's a good question. So I'll find out for you. But anyway, thank you very much, and you all have a nice afternoon. And once again, call me or email me if you have any questions. Thank you.